Good afternoon, one and all. We welcome you all for the 9th session of Alumni Engagement Program 2021-2022. Today, we have our very own alumni from Community Physiotherapy Department, Dr. Asha Sheikh. She is a PG alumni. Dr. Asha is head physiotherapist at Aditya Mehta Foundation, which is the only NGO at Asia level for parasports and adaptive sports, which supports differently able people to pursue parasports. Dr. Asha is also physiotherapist for Indian paracycling team. She is a national classifier for paracycling. She is a national technical official level 1 for para athletics, and her areas of interest is grassroots level development of people with disability and their fitness, parasport rehabilitation, injury prevention, screening assessment for disability sports, classification for parasports educator promoter. Some of her achievements is she has helped in designing people with disability people with disable friendly rehab and recreation center for border security forces for the people with disability in 2017. She has represented as physiotherapist for paracycling team at Asian Paracycling Championship 2018 and also 2019, where the participants have won a lot of awards and prizes. She is presently operating and assisting in various pan-India projects of accessible washroom, rural students development for parasports. And I would wish that before she starts her session, she also shares the latest achievements of these participants, which she recently, the event which was recently held this year, and ma'am has coached them all for fitness. So over to you, Dr. Asha. Please share the latest achievements of your students or of your clients, followed by please begin your session on your experience while pursuing community physiotherapy at Sancheti Institute College of Physiotherapy.
Thank you, ma'am. Thank you for your kind introduction. I feel proud to be an PG alumni of Sancheti Institute. So to start with my experience, currently, as you said, I'm working as a head physiotherapist in Aditya Mehta Foundation, which is the only NGO at Asia level which supports persons with disability to pursue para sports and thus empowering their quality of life. So I would say my roles and responsibilities vary at different places because it's being an NGO, the work structure is different at what we actually do at institute level or maybe at the clinical setup level. So the roles somewhere for the different project I have to lead as a community manager or maybe as a skill training or maybe a health fitness promoter or maybe educator. So this all, and I'm happy to share that throughout this span of 4 years after passing out from Sancheti, I have been successful in all the projects. And that is only possible because of the experience which I have gained throughout my journey of master's program in Sancheti. So that's how, and I'm really very thankful and grateful to all the faculty members of Sancheti, even teaching, non-teaching staffs, and my classmates, which I would say, which everyone feels like there have to be a friendly environment. And I was lucky enough to get, because there was a continuous support and encouragement from the whole staff. So now if I can begin with, like, during this project, I have interacted with many people, many physiotherapists, even in the healthcare profession and even in the sports ecosystem. What made me realize how a Sancheti outstand from the other physiotherapy colleges. Like I have been interacting with the states from Karnataka, Telangana, then Maharashtra. There is like, what makes it exceptional is because of the professionalism which has imbibed in all the students of Sancheti from the day one we start our course. The second, I would say, it is about evidence-based learning. And third, I would say it is because how it holistically developed the overall students to be a professional, to be a self-expert or professional expert in their field. So that's how. So what I have observed, like with professionalism during my PG course, what I have observed that it has helped me to maintain a good relationship with the clients. It may be with the patients, maybe with the healthcare professionals. And same I have implemented what I have realized after like 2 years when I interact with others. Like these qualities have helped me to maintain a relationship with the coaches or a trainer or the strength conditioning or maybe a special educator or the social worker, because few things about the physiotherapy they are not aware about the exercise, and to make them convince them. And this is how it has helped me about the thing which makes us outstanding, which clearly differentiate among the Sancheti students and the other students, I would say. Whereas for the teaching method, which I've observed, like me being and the classifier, the most important, like people don't know much aware about the para sports. So there they have the most important role, physiotherapy as a classifier. And classifier can be a neurophysiotherapist or a community or a sports. But this is not much aware field. So that's why I think this evidence-based approach has helped me to take up some innovative field which we can explore and which we can help to make our India a better in form of physiotherapy field. And why, and somewhere the other reason I feel why the classifier, this is not much aware field, because in few of the colleges, this ICF pattern, which we tell the international classification model, is not much validated or not much being taught to them. So I was like amazed, like how is it possible how they present the case without knowing the ICF pattern? Because when you, as a classifier, when you classify any person with disability, it actually tells you whether the person is eligible or not. There are particular criteria which helps us, which tells that so and so particular person with a different type, with a different level of disability, they are eligible, and that too have to be provided with the evidence. And that is what actually we learn in ICF. So maybe if I don't know, like in Maharashtra it is that, whereas in other states it is not much still. So that makes me feel like I don't know why it is being so. So if that would be improvised, so it will help a lot, and we can improvise the quality and empower more disability section of the people, or maybe any populations to make to take up any activity as a recreational. And other thing which I feel is about the goal-oriented approach, about the evidence-based goal, which I have, like I can remember my first day of my college, where GB sir, Shimpi sir, Rachna ma'am, and from Ortho department, NB ma'am, Simi ma'am, all were there. And we were asked to introduce ourselves. And the second question was, what is our goal? And then so that made me realize, okay, that makes a difference, because whenever I interact with other physio students or I recruit them for any of my projects, I do share my experience. I come to know about their project. So that makes me really feel amazed. Really, I've been very blessed to get the admission, and I've been taught by such mentor, such teachers who have mentored throughout my, like those 3 years. It has been very much successful for me. So about goal approach, the other thing which I always like implement on my other junior colleagues also, to make the grant check. This I came to know when I came to Sancheti. So that time, GB sir, even Shimpi sir, even Rairekar ma'am, then every department have their, in every field, in every physiotherapy department of Sancheti, this were like implemented. So that made us realize how to work for any one particular case, or how to complete the case at what particular deadline. So that makes a person very systematic. And that is what I am applying and implementing now to get it in the proper track every now and then. I would say it was a really kind. And then other I would say how about leadership qualities and the entrepreneurship skills. These are the things which I have never heard from other physiotherapy colleges. They have ever kept sessions about this. So I feel great that this something innovative, everything Sancheti has been doing, and now recently I guess we got to know it is in the top two. I would like to congratulate the whole department, and it is very difficult to get in the. It is very easy to get to be in top, but to be in the consistency, it is difficult. That I can see every day, and how active my alumni is. I feel very proud of it. So that's how I'm like, and that's how I would say that's how my the experience is, and how like everything whatever I have learned, I'm grateful enough that I'm implementing each and every day for every different projects.
That was indeed a great experience that you have shared with us, Asha. But I would like to know how this, how did you try and pursue this para athletes? Like, this is something very different and very different field from a regular physiotherapist would try to follow. But how did you come into this field?
So this was because like as you know, when you pursue community, take up community physiotherapy, you have to go for outreach posting. So I got this opportunity to be to go into the awareness campaign for a disability for the artificial leg, and then later on I got the opportunity to get interacted with para athletes. So that's how I came to know. So one of this reason is, which also outstand from other physio students to Sancheti, is like uh, the opportunity they offer, the clinical experience which we get, maybe not only in this domain or maybe in other field also. We have got like clinical experience and the outreach postings in Kamla Nehru Hospital, which is a different setup. That is in the Kamshed is which is a rural setup. So it helps us to, I would say, it helps us to make the decision making skills very proper and to have a more clarity. So that's how I've been.
Yeah, so it's something a very different field, and I believe Sancheti had some part in getting.
Yes, definitely. It played a big role.
Yeah.
Yes, until and unless there is opportunity is not offered or it is not been introduced, so people will not know. And I'm lucky enough that my department has chosen me that time, and I have succeeded. And I am like I've been very much curious to take to know about the new things. Like I would share one more thing. Like when I was in my final year of my UG days, so that time, community physiotherapy we first got introduced. So I got inspired from Dr. Mayur Rewardkar sir, because I was amazed by his skill and knowledge. That time I decided, yes, I like everything about the physiotherapy, but I'm now sure enough that I'm going to pursue my master's in community. And luckily I got admission in Sancheti, and it has lived up to my expectation. I would say beyond that it has. So
Yes, we are really obliged for your experience and your gratitude. And since you have been working into athletic population, how did you, went into the classifier certification? And I believe there are you have to have a certificate
right,
to work as a classifier.
right.
Yeah.
Right. So first you have to do a national classifier course, which you can do through International Paralympic Committee. So there will be and after this, they do ask for your practical experience with the para athletics. Then they allow you to. And then when your athletes get a clearance note like, yes, they have been classified properly, then they're assured that has the classification is proper. Because it sometimes happens that because of lack of knowledge, few of the athletes, they land up not getting any sports class there. So suppose in paracycling, if I would say, there are bicycling one category, which is for the amputee or the people who have hemiplegic type, or the people who falls under post polio. Those people falls under the bicycle. The other people who have higher lesion, they fall under hand cycle category. The people who have coordination issues, so they mostly fall under the tricycle, and the visually challenged, they fall under the tandem cycle. So there are different sports classes. These were the events, and the sports classes will, for bicycling, it will be C1, C2, C3, C4, C5, and each there are different criteria. So there are like 10 eligible criteria, and those 10 eligible criteria we have to check according to the evidence what we can. Based on the evidence, we have to prove it that so and so person belongs to this category. So in that also there are many. If suppose the athlete is the new, so it will be considered as a new class. And maybe sometime what happens because of the physiotherapy training and a number of other approaches what we do, so they might improve. So they again get reclassified, and it will be so sometimes they will fall under the review classification. So some people will get a confirmed class. The confirmed classes are mostly for amputee people, where there will be no improvement. It will be the stable. The condition for the disability is stable. There won't be any not progressive fluctuation in the impairment. So that's how it is. So apart from paracycling here, like in this NGO, we are also concentrating on other 15 para sports. There are actually 28 para sports internationally recognized, whereas in India, we only play 6 to 7 because it depends upon the infrastructure and how much popular it is, and how much the funding. Because disability section of the society, their main, I would say, the expenses, what I have experienced, it goes towards the rehabilitation. So they doesn't think about going ahead of that rehabilitation. So that is where we, as a physio, when we interact, we do think about the recreational, vocational. So at some point, I would suggest to every physiotherapist, they can, if they think that if any person who is who really have the sportsmanship skill, or who really push themselves to train themselves, we can put them into para sports after once we know that they are particularly eligible. Because there is a term called as minimum eligible criteria. If they doesn't meet the minimum eligible criteria, they are not supposed to participate. So India have this, like Indian population, not in Indian population, in any other also, they do think that if the person is differently able, they are eligible. It is not that so. So every physio should take into this consideration before creating awareness and before like going through all this.
Right. So classification is a very important system to classify
Yes, right.
an athlete in a right way so that he doesn't have any problems facing ahead, I believe.
Yes, right.
So with this, do you have any future plan with respect to research? If you would, like, since you're working in this population,
Yes, right, right.
we really create more awareness. So do you have any plan in this?
Yes, yes, I definitely have lots of plan, and we actually, like for all the athletes, we have a different systems, the database, which helps us. Like for being for paracycling, it's the like this foundation is mainly considered for the paracycling. So anyone who wants to represent India, they have to train over here. So we have those particular infrastructure, equipment, and the data systems, where we actually day to day we regularly monitor their different parameters such as cadence, or maybe power, or maybe the speeds, and depends upon that the rehabilitation change, about the nutrition. We have to interact with the team. So that's how it works as. So I have been the software, normally we use the Garmin as a software, which is more reliable one. So this actually has so that's why I can tell you that everything whatever I have learned, and the most important skill which I have improved during my PG days, I would say, is the evidence, like about the research knowledge what we have gained. So I really feel blessed. Yes, it was the right time and the right decision I took, and I know the future was about to come this way. So it has helped me. So we have lots of data, but somehow being an NGO, the structure of the human resource is different. So maybe sooner we will develop. And in para sports, normally there is a lack of awareness, lack of literature, I would say, because it's become very difficult for every like when we recruit any athletes as a team, like where the coach or special educator, the physiotherapy is there, we we don't know the normative value, what actually will be their energy expenditure, or maybe the fitness, or maybe a kind of exercise. I have to, like, since 3 years, I have been this 4 years span, I would say, I have to, like, we as a team have to think like differently for every person. We have to customize everything, like whether it is sports equipment or any exercise strategy we are planning.
So yeah, yeah, that would be a tough situation, but I think you would be doing well in that too. And lastly, you said you are looking at into many sports. So would you like to elaborate on those? Like what, as a physio, you have been looking them onto?
Okay, so the in para sports, the most eligible, what I would say, most eligible criteria are 10. But apart from this, the three other things like visually challenged, physically challenged, and intellectually challenged are eligible. Whereas for other challenged population like hearing and they have a different, I would say, the games. So in this, here presently we are working for 15 different sports, but we do conduct like every year national training camp where we screen for all the 28 sports. So only depend upon the infrastructure. Here we have limited to 15. So paracycling, which I have already discussed. The second, I would say, about the athletics, and which is more like, I would say, we have one more medal in Paralympic in para athletics. So what happens in para athletics depend upon the different type of disabilities, the equipment changes. Or if suppose they have a higher lesion, or a person is polio affected, they will be using athletic wheelchair where they will be seated on a particular chair where the dimension have been given, the technical rules there are particularly. But depend upon that, they will use that particular athletic chair, and they will be doing whether all those track field events like discus throw, shot put, and in the club throw. So those kind of things. Whereas for I would say for the track event like 100-meter, 200-meter. So this differs for different sports class and depends upon the disability also. So one is this for parachuting. Again, for wheelchair user, there is a different class. The people where only one side is affected, for them the technical rules are different. For them the exercise have to be given different, because at the end you have to customize it and make sure that they don't land up into problem during classification. So we have to also make it into consideration that depend upon the classification, we have to train them, because sometimes it might happen that because all of a sudden they have changed the classification during the event. So it should not happen. So before doing classification, we should keep into mind that this exercise might improve, which we really require or not. So it has to be very systematic in this case. Whereas for able body, we can like do, but in their case, they might lose a chance or they might get shift, and it creates a lot of like psychologically they get really lot affected during the competition when the classification got changed. I have experienced at international level also. About the archery thing also, here we have few athletes who doesn't have both the upper limbs, but he is using his mouth to pull the arrow. So there are different, so the people do think, okay, how I will do this for this, particularly the hand is required. Then we have to make them understand, it's not always like the skill have to be with your hands. There are different customized things or the accessory sports equipment which will be required. There are different technical things which is required. So that makes a difference. Whereas for powerlifting, we have three athletes over here that only depends upon the weight category, and they fall, they have to do only bench press, where in able body we do mostly the deadlift is there. But in this only bench press is there, and that also depends. And that too, what happens, like I have one of the athletes who is a spinal cord injury survivor. He is getting trained for para powerlifting. At the same time, he undergoes rehab. Then we have to work as a team with the nutritionist that he should manage his weight category proper. So based on the energy expenditure, I have to later on work. Yes, really. So those things matters a lot in their cases. So yeah, that's it. Then Bosha is one of the game. Then sitting volleyball is one of the game. So there are a lot many things, but yes, it differs. It just have come through the lot of experience. So that's how. But yes, I would say like every physiotherapist should think over and come ahead, and because everyone have this, I would say we know everything. It's about the implementation.
The background,
Yes.
and it's just implementation, like you said.
Yes, right, absolutely.
Right. And just one more question. So since you said that it has this training the para athletes is a very systematic job, and you have to have a holistic approach. So how would you say that Sancheti has helped you in inculcating discipline and creating the urge to have holistic approach towards each of your patients?
Yes. So I would say, like, I remember those words from Shilpi sir, which he always says, treat condition as not a health condition, but as a human. So that I believe, which I really implement to everything. And that's where that India is also, the world is leading, that holistic approach should be there. So holistic approach can only come when we work as a team, when we have this professional ethics to deal with every uncertainties and work professionally. So as a team over here, whenever the first is the counseling part, which is nothing but the special education, because whenever a person is all of a sudden become differently able, or a person after a long person is again like trying to be again to his track to again relive his life. So that time it is very important as a physiotherapy to make them aware the importance of exercise and about the rehabilitation, how it will improve their life. And that's how, like, when I for screening I have to go to remote places, sometimes to rural, sometimes to regional centers also, sometimes to urban population, and somewhere some differently able schools. So that time I have to interact with the special educator, maybe social worker, or maybe the administrative setup like the collector, or maybe some governing body, to make them understand why there is a need. Because I have observed, like in many schools, they do have a sports, but not with the term called as like para sports. So what the syllabus which we have for the able body, the same has been taught. So they are not aware, and that's how that is maybe one of the reason I believe that we don't get more medals, because it's been not introduced in your curriculum. That inclusion is not there in the society. So this is the most important part, where is like as a physiotherapy, we are creating awareness in the first part, the counseling, and then later on the screening. Like the screening helps us to know by with the help of coach, like to know whether they are eligible or not, or who is fit enough, or maybe whom we can take up for the sports on the immediate basis. Like there are level criteria. Maybe they will require some rehabilitation rehabilitation based upon their impairment, and later on the sports will be taken up. And then as this NGO is mainly for the grassroots development, grassroots development to international, and that's how the counseling, then screening, and then particular rehabilitation, and then sports specific rehabilitation, and then taking up to the international. So I have seen, and like I would say more than 40 presently in the span of 4 years, like growing up from zero to hero. And it really makes me proud, feel that yes, I have been able to contribute so much thing. And apart from this, we as a team here have screened a number of Divyang armed force people and many people. So there are a number of projects which is going on parallel. So this has made me sure to work as a overall development for the people with the help of team as a team-based approach, I would say.
Yeah, that's a truly, there are a lot of what do you say, points, and there are a lot of people coming into picture who are helping these people, and I believe that physiotherapy has a great amount of role in this.
Yes,
On this note, I would like to thank you on behalf of Sancheti alumni and Sancheti College of Physiotherapy for sharing your experience, for your time. And I believe with this, people must have got some urge to, work with these people, because I believe there is so much to do. I mean, so much to do to create awareness among the regular people, amongst the para athletes, that what they can do, because the major part is the psychological impact they have because of this. So if they do something that will be boosting to them, it will boost their morals, and that will help them to grow better and also into a better future. So I hope with this talk, people will be able to join you, help you, and create more awareness about the para athletes, and in general the differently able people, I would say.
Yes.
So
already Sancheti have already started long back, and I'm sure that they will be continuing to do so. So that's what I would say. And thank you for giving me the opportunity to share my experience.
yes,
Thank you so much.
always looking forward to our alumni. So on this note, I would like to end this session, and thank you for your time and support.
Thank you, ma'am. Thank you so much.